Training Room, presented by Northwell. We're rewriting history by giving women the care they deserve. Northwell, raise health.
Liberty star Breanna Stewart recovering from meniscus surgery on her right knee just over a month ago, but the two-time WNBA MVP is expected to be ready to go when training camp starts on April 27th. So what exactly did she have done, and how will she be so quick? How will she back so quickly to help the Liberty defend their title? We asked Dr. Brandon Joseph Erickson, an orthopedic surgeon and sports medicine specialist with Northwell Health.
The meniscus, if you think of it as basically a little shock absorber that sits in between the end of your thigh bone and the top of your shin bone. You have one on the inside of the knee, one on the outside of the knee, and it helps kind of cushion the space between the bones and absorb some of the stress that's there. And occasionally from a twisting injury, landing funny on it, or just from some wear and tear over time, you can get some small tears. And so occasionally people can have these tears and it doesn't cause them any problems, and so we leave them alone. And occasionally people have these tears and we try certain things and they don't get better, so we operate on them. In Breanna Stewart's case, obviously, hers was bothering her enough to have surgery. And there's two ways to treat a meniscus tear. You can go in and you can fix the tear in the meniscus by basically stitching it back to where it belongs, or you can trim it out, almost like clipping a hangnail. So in her case, she had the kind of trimming out of the meniscus, which is basically just cleaning up the piece of the meniscus that's torn, leaving the rest of it alone. That way you've taken out that mechanical irritant from inside the knee. When we just clip out the piece that's torn, you're not waiting on anything to heal from the meniscus perspective, so you're just basically waiting on the swelling in the knee to go down from surgery and from the injury, and then getting their quad muscle back to normal. So usually from just the trimming out of the meniscus, you're looking at somewhere between a 5 to 6 to 8 week recovery, give or take, depending on how the person's knee recovers. The surgery's outpatient, takes 10 minutes, so she came and went the same day. And then basically the day after surgery, she can put her full weight on it as much as she's comfortable. So the whole game after any type of knee surgery is getting that quad muscle to get back to normal. So what the rehab people are doing, and because obviously she's a professional athlete, this is happening to her 5 to 7 days a week, is they're working on getting that muscle to wake back up with strength training exercises, stim. She probably has some red light therapy that's going into it, and a couple other modalities to try to speed along her recovery, because she's not going to feel good and feel like she's back at 100% until that quad muscle's back to normal.
By the way, Dr. Erickson's the best. He's actually looking at Jackson's ankle, which he messed up playing on stairs. Not exactly a positive. A reminder, NASCAR is Doc Erickson's the best.